All right, let's dive right into this deep dive on emergency tooth extractions. We're tackling your request, and I gotta admit, thinking about those emergency dental situations, it can be kind of unnerving, right?
Yeah, for sure.
Like, I remember one time I chipped my tooth on a baguette. A baguette, of all things, right?
Oh, no.
Turned out fine. But it definitely got me thinking about, those times when it's more than just a minor mishap. Like, when do you actually need to, like, freak out and call the dentist immediately?
Yeah,
So consider this your crash course in knowing when that toothache is actually a 5-alarm fire.
I like it.
So our sources, they lay out some pretty clear signs that scream, emergency! And we're not talking about just your usual, oh, my tooth is a little sensitive after a cold drink.
Right.
This is next level stuff.
Mm.
Like pain so intense it decides to invite itself over to your jaw, your cheek, even makes its way up to your head.
Yeah.
You know it's serious when your face joins the party, completely uninvited. And then there's the whole swelling thing.
Oh, yeah.
That's never a good sign.
Never a good sign.
We're talking puffiness that would make a chipmunk proud.
Ooh, definitely.
Oh, and I can't forget to mention the possibility of pus.
Oh, yeah.
Yeah, apparently teeth can do that,
Oh,
which honestly
it's not great.
just seems unfair.
It's definitely not something you want to see, that's for sure.
No.
But what's interesting is that all of these kind of unpleasant symptoms we're talking about, it's actually your body trying to get your attention. So that swelling, it's inflammation, right? It's your immune system's way of trying to fight back against infection.
Ah, so it's actually doing something good.
Exactly. And the pus, think of it as like a microscopic battleground. Your white blood cells are duking it out with bacteria.
So it's a sign that there's like a serious infection going on. Not just a minor skirmish, like a full-blown war inside your tooth.
Precisely. And that's where understanding the bigger picture is so important, right? Because what starts as this localized infection in your tooth or gums, if it's not addressed, it can quickly escalate. We're talking about the potential for it to spread to your jawbone, your sinuses, even your bloodstream in some cases. That's how people end up with those serious complications, like cellulitis, which, that can be life-threatening.
So when they say emergency, they really mean it.
Ab-
It's not just about, getting rid of the pain. It's about preventing something much worse from happening.
Exactly. Early intervention is key when it comes to dental infections.
All right, so we've covered the pain, the swelling, the pus. But what about trauma?
Ah, yes.
I mean, we've all had those moments where we bite into something that we shouldn't have.
Yes.
And I feel like I've chipped a tooth on more unexpected things than I can even count.
Oh, yeah. Like what?
Popcorn kernels, rogue pieces of candy, you name it, it's happened. Usually it's just a, well, that's annoying kind of situation. But when does it actually cross the line into, oh, this is a dental emergency?
Right. You're right, though. I mean, those minor dental mishaps, they're practically a rite of passage. We've all been there. But there are those times when a chipped tooth or even a knocked out tooth needs a little more than just a sigh and a trip to your dentist's voicemail.
Right, right.
Our sources actually highlight those uh-oh moments really well. Think like sports injuries,
Okay.
falls, or, biting down on something that was definitely not meant to be a chew toy.
Yeah, I've been there.
Yeah.
Okay, that makes sense. But how do you know if it's actually serious enough to warrant like a panicked, I need to get to the dentist like right now situation? Like, is it just a judgment call or are there like actual telltale signs?
That's where those sources come in handy because they give us some clarity, right? So while a minor chip or crack, it might not be an immediate, oh my gosh, run to the dentist crisis. It's always wise to just have a dentist assess the damage.
Okay.
Because you see, even those seemingly small fractures, they can actually compromise the tooth structure, making it, vulnerable to more damage down the road or even an infection.
It's like the old saying, right? An ounce of prevention is worth a pound of cure. Or in this case, like a whole lot of dental work.
Precisely. It's always better to err on the side of caution.
Right.
And just get that professional opinion.
Yeah, better safe than sorry.
Oh.
Speaking of professional opinions, our sources, they also kind of delve into the different types of extractions. Simple, surgical wisdom teeth. To be honest, this is all a bit of a mystery to me. Like, what actually happens during these procedures?
It's good to be curious. Understanding the basics can definitely make the whole experience way less intimidating. So, imagine this. A simple extraction. Pretty straightforward. The tooth is visible above the gum line,
Okay.
and it can be, shall we say, gently encouraged to part ways with its cozy little spot.
Gently encourage. I like it. So no, like, tiny little tooth-sized crowbars involved?
Not quite, but surgical extractions, on the other hand,
Okay.
those are a bit more complex. They often involve removing some of the gum tissue or even bone to access the tooth.
Oh, wow.
And then there are wisdom teeth, which
Ugh.
those tend to have their own agenda.
Don't even get me started on wisdom teeth. Mine were basically like staging a coup in my jaw. It was a whole thing. But let's get back on track here.
Yeah.
We've talked about those telltale signs of a dental emergency, right? The pain, the swelling, the whole pus situation. But it just seems wild to me that something that seems as minor as a cavity could turn into this whole big emergency situation.
Yeah, it's easy to think, oh, it's just a little cavity, I'll get around to it eventually. But then you hear about these emergency extraction stories, and it's like, how does it even get to that point?
It all comes down to these tiny but mighty bacteria. Our mouths are like teeming with them, right? And when you have a crack, a chip, a cavity, it's like giving them a VIP pass to the inside of our teeth.
So that tiny cavity you've been ignoring. Basically a welcome mat for a whole lot of trouble. Exactly. And once those bacteria, they set up camp, they can multiply and cause an infection, often in the pulp of the tooth.
Uh-oh.
Yeah, and that's the soft inner part, with all the nerves and blood vessels. Definitely not where you want an infection brewing.
That sounds unpleasant, to say the least. And I'm guessing that's when root canals enter the conversation.
Sometimes, yeah. But other times, an emergency extraction is necessary. And, in those moments, it's helpful to know what you're in for.
Oh, for sure.
Because let's face it, even routine dental procedures can be a little nerve-wracking.
Yeah.
Knowing what to expect can really help ease the anxiety.
Absolutely. So let's walk through it. What actually happens during an emergency extraction?
Okay, so first things first. Your dentist is going to make sure you're comfortable. We're talking anesthesia to numb the area. Depending on the complexity, it might be a local anesthetic, or in some cases, they might even use conscious sedation.
Okay, so you're nice and numb, which is a good thing when we're talking about tooth extraction. But what about the actual removal? How does that even look?
All right, so for a simple extraction, the dentist will use an instrument called an elevator to loosen the tooth, and then forceps to gently kind of rock it back and forth until it comes free.
It's like a...
It's a bit of a delicate negotiation with your tooth.
I was going to say, it's like a delicate dance they're doing.
Exactly. But then for surgical extractions, which again, those are the more complex ones, a small incision is made in the gum to access the tooth.
Okay.
And sometimes, if a tooth is being particularly stubborn,
Oh, no.
they might need to section it.
Section it. What does that even mean?
It basically means they divide the tooth into smaller pieces to make it easier to remove.
Oh.
So it sounds kind of intense, but just remember, you're numb for all of this, and your dentist will guide you through every step of the way.
That's good to know. Yeah, it's
Yeah.
definitely reassuring to know that dentists are, they prioritize making the experience as comfortable as possible.
Right.
Speaking of comfort, let's not forget about everybody's least favorite part of dental care, the bill.
Right.
What kind of financial, impact are we talking about with emergency extractions?
It's true. Dental work can be an investment. Costs can range from a few $100s for a simple extraction to over $1,000 for a surgical extraction or wisdom tooth removal. That's why it's so important to, just understand your dental insurance benefits. Don't be afraid to call your insurance provider and ask about your specific plan.
Yeah, it's always better to be informed. So we've covered a lot of ground here, the warning signs, the procedures, the costs. Ultimately, what are some things that people can do to try to, avoid needing an emergency extraction in the first place?
That is the million-dollar question, isn't it?
Right.
It really boils down to preventative care.
Okay.
Brushing, flossing, those regular dental checkups, those are your best defenses against needing a tooth extracted, emergency or otherwise.
So in a nutshell, take care of those pearly whites. And if something feels off, don't hesitate to go get it checked out. Always better to be safe than sorry, right?
Couldn't agree more.
And there you have it, Deep Divers. A crash course in emergency tooth extractions, packed with all the essential information you need to navigate those, shall we say, less than ideal dental situations. Remember, knowledge is power, especially when it comes to your health. Until next time, stay curious and keep those smiles shining bright.